Hello everyone, I'm David from the medical department of CE Intelligence, which is a high-tech company specializing in the development of medical rehabilitation robots. I'm honored to share with you today's topic, application of closed-loop rehabilitation theory in hand function rehabilitation after stroke. First, let's get some background on stroke and hand dysfunction after stroke. Stroke, also known as cerebral vascular accident, is an acute cerebral vascular disease, which is a group of diseases that cause brain tissue damage due to sudden rupture of blood vessels in the brain, or blockage of blood vessels that prevent blood from flowing into the brain. An analysis published in 2016 by the Lancet Journal said that in 2016, 13.7 million people worldwide had a new stroke. According to the epidemiological studies, stroke has become the second leading cause of death in the world after ischemic heart disease, and it is also the leading cause of serious disability. More than half of stroke patients have hand dysfunction. As we know, the hand is one of the most sensitive and dexterous organs in our human body. The function of the hand is highly complex, since it corresponds to a large area of the cerebral cortex. Brain injury can easily cause hand dysfunction and is difficult to recover. Clinically, most stroke patients have a more severe upper limb dysfunction than lower limb. During the rehabilitation process, the recovery of the lower upper limb is often slow, and the recovery of the lower limb is relatively fast. Generally speaking, upper limb rehabilitation is more difficult than the lower limb. In clinical hand function training, there are usually some difficulties or limitations. For example, first, one-on-one training is inefficient. Second, training process is boring. Third, training process cannot be preset controlled. Fourth, unable to provide real-time feedback. In the second part, let's find out the closed-loop rehabilitation theory and its application. The central peripheral central closed-loop rehabilitation theory is proposed by Professor Jia Jie in 2016. Professor Jia is a well-known expert of hand rehabilitation in China. The core idea of this theory is that the comprehensive application of central and peripheral interventions can better promote hand function, and on the basis of general peripheral intervention, central intervention should be emphasized. So, what is central intervention? It means direct stimulation of damaged or functional brain areas. The most commonly used central intervention techniques include transcranial direct current stimulation, brain-computer interface, mirror therapy, motor imagery therapy, and transcranial magnetic stimulation. As the name implies, peripheral intervention is a treatment technique that acts on the peripheral limbs of the body. It includes the four neural facilitation techniques: BOBAS, brainstorm, PNF, and ROOT. Other treatment techniques include occupational therapy, constraint-induced movement therapy, biofeedback therapy, electrical stimulation technology, and so on. Peripheral interventions provide continuous input of stimulation to the central nervous system through the sensory motor system, or through intensive training of correct motor patterns to promote the remodeling of the central nervous system to restore hand function after stroke. What is the principle of this theory? The central intervention is to activate the functional brain areas and improve neuroplasticity. The peripheral intervention is to strengthen the positive feedback and input of sensory and motor control modes to the center, thereby promoting the remodeling of brain function. At the same time, or after the central intervention, the commonly used occupational therapy or physical therapy is reasonably given in its state of activation of the brain area. Based on the closed-loop theory, CE Intelligence Company developed the hand function rehabilitation robot shown in the picture. This hand function rehabilitation robot integrates a variety of training modes, including peripheral interventions and central interventions. I'll explain it to you in detail later. Compared with traditional hand function rehabilitation training, this robot has some obvious advantages. First, it can replace repetitive manual exercise done by the therapist and can be used by two patients at the same time. Therefore, it is more efficient. Second, it can record and trace the assessment and training data of each patient, making it easier to the therapist and the patients to evaluate treatment effects. Third, it conforms to the principle of rehabilitation and is highly professional and scientific, and can cover the whole circle of rehabilitation of patients. Fourth, through interactive games and task-oriented training, patients' interest and compliance can be improved. Gloves are available in different sizes to cover most adults and children. Through the user-friendly design, the patient can wear it with one hand without the help of others. Alright, let's take a closer look at the features of this product. Before introducing the training modes, I would like to talk about the classification of muscle strength, because the choice of training mode is mainly based on the assessment of the patient's hand function and the muscle strength. To assess a patient's muscle strength, the most common method we use is manual muscle testing. It refers to a method in which the examiner uses his own hands to judge the muscle strength by feeling the strength or observation of the muscle contraction and examination and measuring the movement ability of the limbs. This method is simple and feasible and have been widely used in clinical practice. Let's take a look at its grading criteria. Muscle strength is classified into 6 levels from 0 to 5. Grade 5 means the patient can complete the full range of motion of the joint against gravity, and at the same time can resist the maximum resistance exerted by the tester at the end of the joint motion. Grade 4 means the patient can complete the full range of motion of the joint against gravity, and at the same time can resist a moderate degree of external resistance at the end of joint motion. Grade 3 indicates that the patient can only complete the full range of motion against gravity, but has a low ability to resist the resistance exerted by the tester. Grade 2 means The patient can perform a full range of motion in a gravity-defying position. Grade 1. The patient has low visible joint movement but can feel muscle contraction on palpation. Grade 0. The patient has low muscle contraction at all, either visually or by palpation. So, when the patient's hand function is very poor and the muscle strength is very low, such as when the muscle testing is grade 0 or grade 1, we can use the passive mode. In passive mode, we can adjust the time of hand grasping and extension, and can perform task-oriented training. For patients with high muscle tone, we can turn on the antispasm function in the settings. You can watch the video. Choose the antispasm mode. The movement is very slow. As you can see, the patient is doing task-oriented training in passive mode. Task-oriented training emphasizes active participation in controlled exercise training and repeated reinforcement in order to promote the functional reconstruction of the central nervous system. When the muscle strength of patient's hand can accommodate a small range of joint, the assistance mode can be used. When the force sensor in the glove captures the patient's movement intention, the glove can automatically help the patient to accommodate the movement of grasping or stretching, as you can see in the video. Mirror therapy is a treatment method that uses optical illusions to allow patients to visually feel the movement or touch of the contralateral limb, just like the paralyzed or painful limb, thereby affecting the affected side and promoting the functional recovery of the affected side. Mirror therapy is an effective treatment for stroke patients who do not initially have distal upper extremity movements. Based on the principle of mirror therapy, we developed an innovative mirror therapy or bilateral mirror training. The patient wears state gloves on the unaffected side and power gloves on the affected side. When the affected side makes an action, the affected side makes the same action as the unaffected side. On the basis of traditional mirror therapy, by adding real tactile stimulation, auditory stimulation, and multimodal stimulation of the primary motor cortex, the innovative mirror training can significantly improve the patient's limb perception, highly restore the real scene of hand function movement, and activate more efficiently central nervous system. Promote the recovery of upper limb motor function in stroke patients. The refined single finger training mode is an active training mode. Through this mode, the patients change from passive participants to active learners. According to the video tips, the patient completes the designated active gastro training and can adjust the detailed movement parameters, gradually strengthen the combination of the movement, and improve the hand movement ability and coordination. We can use manual mode when the patient has poor cognitive function or cannot understand the instructions on screen. By holding the hand switch in the unaffected hand, the affected hand can be controlled. The hand switch can also be controlled by the therapist or the family member. Resistance training. Resistance training mode can be used when the patient's muscle strength is grade 3 or above. The resistance mode is divided into two intensity levels, low and strong, and the appropriate training mode can be selected according to the patient's hand function to help the patient recover more effectively. In the interactive game mode, the patient's affected hand wears a data glove for game training. Interactive games can enhance, accelerate, and induce central control of the affected hand. In the last part, let's take a look at the application of this hand function rehabilitation robot. This product has a wide range of application scenarios in hospital, such as rehabilitation department, neurology department, neurosurgery department, stroke center department, orthopedic department, and burns department. This product can be used for hand dysfunction due to various reasons, such as stroke, traumatic brain injury, cerebral palsy, orthopedic surgery, breast cancer, and hand burns. The product is available in a medical and home version, so patients can train in the hospital as well as at home. In other words, training can extend from the hospital to the home. As I mentioned before, the therapist can select the training mode suitable for the patients based on the assessment of the patient's hand function and proceed step by step. Therefore, this product is suitable for patients with muscle strength from grade 0 to grade 5 and can cover the full circle of hand rehabilitation. A clinical study shows that robotic hand function training can improve joint range of motion, reduce abdominal muscle tone of hand, improve activity of daily living ability, improve muscle strength, and prevent spasms and eliminates edema and promotes neural pathway reconstruction. In the Chinese market, our products have covered more than 3,000 hospitals and more than 20,000 families. Since 2018, these product series are exported to more than 80 countries and regions around the world and are highly prized by the rehabilitation therapists, professional rehabilitation institutions, and patients because of its practicality and innovation. Okay, this is the end of my speech. Thanks for your listening.